Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also Esic, Dsssb, Aiims Norcet, Kerala PSC, DME exam, Jphn exam, Insurance Medical Service exam. Today in this video we can see important questions, also previous year questions from Psychiatric Nursing. First question, who is the first psychiatric nurse? And our options, option A Jean Watson, option B Linda Richard, option C Sigmund Freud, option D none of this. And the correct answer is option B Linda Richards. The first psychiatric nurse is Linda Richard. And the next question, the state of complete disorganization and confusion which leads to loss of identity and direction is known as. Options, option A equilibrium, option B bargaining, option C chaos or disruption, option D resistance. Here the question is a state of complete disorganization and confusion, that is the patient is disorganized and confused which leads to loss of identity and direction is known as chaos or disruption. Option C is the correct answer. That is, the person is not able to cope up with the existing problem and become disoriented or confused. That is known as chaos or disruption. Okay. First option equilibrium means a state of balance. Second option bargaining means a state of grief or a process of neogolism. Third option, fourth option resistance means is an action or inaction towards the changes. That is particular changes occurs we are trying to resist. That is resistance. And the next question, formed visual hallucination are seen in the lesions of. Options, option A occipital lobe, option B temporal lobe, option C parietal lobe, option D frontal lobe. Question is, formed visual hallucination are seen in the lesions of temporal lobe. Option B is the correct answer. And the unformed hallucinations occurs due to the lesions of occipital lobe. Here formed hallucinations in temporal lobe. And the next question, mini mental status examination does not include. Options, option A cognition, perception, option C insight, option D history of psychiatric disorder. Mini mental status examination is a cognitive test which is used to screen for the presence of cognitive impairment. Here the question, mini mental status examination does not include. So it includes cognition, perception, insight, but it does not include history of psychiatric disorders. Okay, this is one of the cognitive tests used to identify the presence of cognitive impairment. And the scoring of mini mental status examination 25 to 30 is normal, 18 to 24 means mild to moderate impairment, and 17 or less means substantial impairment. So the normal score of mini mental status examination is 25 to 30. And the next question, temporary discharge of the patient from the psychiatric hospital is known as. Options, option A parole, option B abscond, option C termination, option D escape. The temporary discharge of the patient from the psychiatric hospital, okay, that is known as parole. Option A is the correct answer. Parole means with the presence of concerned relatives or concerned person, the psychiatric patient is released from the hospital to attend certain pujas or to attend certain functions. Okay, they are releasing from the hospital. That is known as parole. The next question, temporary loss of muscle tone and weakness precipitated by a variety of emotional state is called. Options, option A cataplexy, option B catharsis, option C compulsion, option D confabulation. And the correct answer is option A cataplexy. Cataplexy means is one of the sudden or transient episode of muscle weakness or loss of muscle tone which is precipitated by some emotional factors include some emotional laughing or emotional crying, okay, that may precipitate some loss of muscle tone or muscle weakness. Patient may experience that is known as cataplexy. And the next question, assuming all members of the group in same fashion are called. Option A, cultural imposition. Option B, cultural competency. Option C, clustering. Option D, stereotyping. Assuming all members of the group in same faction are called stereotyping. Option D is the correct answer. And the next question, a state of diminished consciousness in which patient remains mute and still with the eyes are open is called. Option A, catatonia. Option B, stupor. Option C, panic. Option D, hysteria. And the correct answer is option B, stupor. That is a state of diminished or decreased consciousness and the patient remains mute. He is not talking or he is not doing anything. He remains mute and just eyes are opened. Okay, only opening the eyes but sitting without doing anything. Just mute and decreased consciousness. That is known as stupor. And the next question, multiple referrals between psychiatrist and other professionals is called. Option A, steering. Option B, ganging. Option C, ping-ponging. Option D, touting. And the correct answer is option C, ping-ponging. Ping-ponging means the patient is repeatedly passing from one doctor to another doctor or one physician to another physician, from there to another doctors. That is multiple referrals between psychiatrist to another professional, from one doctor, one psychiatrist to another doctor, from there to third party. That is known as ping-ponging. And the next question is, which of the following are the risk factors of childhood psychiatric disorders? Options, option A, paternal psychopathology. Option B, repeated early separation from parents. Option D, harsh or inadequate parents. Option D, all of this. Question, risk factors of childhood psychiatric disorder. And the correct answer is all of this. That is parental psychopathology or parental related problem and repeated early separation from the parents and harsh parents or inadequate parents. Parents are not with the children. All are the risk factors of childhood psychiatric disorder. The next question, abnormal drowsiness in daytime is known as. Options. Option A, narcolepsy. Option B, somnolence. Option C, somnambulism. Option D, sleep ataxia. Abnormal drowsiness in daytime is known as narcolepsy. Option A is the correct answer. And the next question, a person is able to speak only in whisper. Option A, aphasia. Option B, aphonia. Option C, mutism. Option D, stuporness. That is, the person is having inability to produce sound. Okay, can speak only in whisper. That is known as aphonia. Option B is the correct answer. So far we discussed some of the previous year questions and also important questions for coming exam preparation. Surely people will get an idea from where the questions are already came. So thank you for watching my channel. If it is useful for your studies, please subscribe and share my videos to your friend circle.